Good morning, Mr. Petiti. My name is Madison. I'm going to be your nurse practitioner today. Today we're going to be doing a head-to-toe assessment. Does that sound okay to you?
Mm-hmm.
Okay, great. So the first thing I'm going to dive into is I'm just going to take a peek at your head. I'm just inspecting his head for any lumps, bumps. Do you have any tenderness anywhere? No. Okay, I'm just going to palpate as well. I'm looking for any like patchy hair loss. I don't feel any abnormal bumps, anything like that. I'm going to take this opportunity to feel his lymph nodes as well. So we'll start with the suboccipital. And then you can lift your head up a little bit. We'll do the posterior auricular, the preauricular, and then down to the submaxillary and the submental, and then the cervical. And then if you can just arch forward a little bit, I can kind of feel his supraclavicular lymph nodes as well. And I'm looking for any palpable lymph nodes, which he does not have, which is good. The next thing that we will be moving on to is the TMJ. So I'm just going to kind of get in my fingers lightly on that TMJ, that joint there, and then ask him to open and close his mouth a couple times. And I don't feel any clicking or hear any clicking. Did that hurt at all when you were doing that?
No.
Okay, great. Next I'm going to be just palpating his carotid artery, so at the level of his thyroid there. I'm going to do one side at a time. I'm just going to be feeling for the pulse in your neck, okay? Good. And the other one. Good. And then I'm going to be listening as well with the bell and the diaphragm of my stethoscope. This might be a little cold. I'm just going to ask you to hold your breath, okay? Breath in and hold it. Okay, you can breathe now. And then I would do the other side. Take a breath in and hold it. Good. Next, I would be looking at his thyroid. So I would be behind him as much as I can. And I'm just going to be placing my hands on your neck, and you sit up a little straight for me. I would have looked before. I'm looking from both sides at his thyroid. I already assessed it anteriorly when I was assessing his head and his neck. And then I'm just going to be placing my fingers and feeling and moving it up and down, side to side. And then can you swallow for me? Good. And it feels smooth. I don't feel any lumps or bumps. Do you have any difficulty swallowing? No. Okay, good. I'm not seeing any goiter, anything like that. So next we'll move on to the ear assessment. So I am going to take my scope with the correct speculum on it, specula. I'm doing a assessment from the front. Just look straight at me. It looks even. I don't see any swelling, any abnormalities. And then I'm looking from the side, and I'm going to be palpating his pinna and the mastoid process there, and everything feels good. Now I'm going to be looking inside your ear, so I'm going to take, with gentle pressure, pull up and back, and I'm going to take my scope, and I'm going to look inside and visualize the tympanic membrane. It's pearly gray. He has a cone of light at about 7 o'clock on the left side here, and I don't see any swelling or anything. And then as I'm coming out, I'm looking at the inside of his ear canal as well. I would do the same thing on the other side too. Palpate, inspecting, mastoid process, and then pulling up and back. Tympanic membrane, there's a 7 o'clock cone of light on this side, and then looking at the inside of the ear canal. I don't see any excessive serum or swelling or obstruction or anything like that. Next, we'll move on to his eyes. So I'm going to be looking at the conjunctiva, so I'm going to be pulling on your eyelids a little bit. I'm doing a visual inspection first. I don't see anything obviously abnormal, no swelling, redness, drainage. I'm going to gently pull down your lower lids to look at the palpebral conjunctiva, and then the upper ones too. Good, and everything looks good. I don't see any redness. And then the bulbar conjunctiva, I'm looking at and assessing just when I'm looking at him, the whites of his eyes, everything looks red. I don't see any swelling, drainage, anything like that. Next, we're going to check your pupil response. I'm going to shine a bright light in your eyes. I'm sorry about this. I'm going to help you keep your eyelids open, so just try to look straight ahead, okay? I'm checking for direct constriction and consensual constriction. And then I'm going to place my finger close to your eye and then look at it and look towards me. And look back to my finger. And that's near constriction. Everything is intact. His pupils are constricting evenly, bilaterally. And then we'll be doing the fundoscopy exam. So I would be taking my scope, and then I'm using my right hand and my right eye to look at his right eye, and I'm coming in from the temporal side. Can you just look kind of over my shoulder and at an even level with the patient, and I'm seeing like the red reflex. I'm coming in and I'm visualizing the optic disc and the arteries and the nerve, and then the macula, and I don't see any abnormalities. The color is good. And then I would be doing the same thing on the other side, my left hand and my left eye for his left eye, but for sake of time, we will not be doing that today. Next, we're going to be taking a peek at his nose. So we are going to be looking at it straight on. Have you noticed any drainage or anything from your nose, any abnormalities, any difficulty breathing in through your nose? Great. So if you just tip your head back a little bit for me, I can visualize the septum from here, and everything looks even, and I'm going to come in. I'm just going to touch your face, and I'm going to go away from the septum with the speculum and look at the inside of his nasal canal. I can see the middle and the turbinates in there, and I don't see any drainage, any obstructions, and then I would do the same on the other side for the other nostril too. Again, no obstructions, no drainage, no erythema, no increased swelling, anything like that. The next thing we're going to be looking at is his mouth. So we'd be taking a tongue blade, if I had one, and yeah, taking a look at his teeth. Thank you. His teeth look nice. His lips are even. His dentition looks great. I'm going to ask you to open your mouth and say ah. Great. And then, can you stick your tongue out for me? And I would be depressing his tongue down. Can you move it side to side? Lift it up. Great. And then can you tuck your tongue behind your teeth, and I would be depressing it down. And then looking at his oropharynx, I can visualize that way, looking at the back of his throat there for any cobbling. I'm looking at his tonsils for any inflammation. I'm looking at smooth movement of his uvula, and also assessing his dentition as well, looking for any signs of infection, any swelling. Nothing abnormal there. Next, we move on to the respiratory exam. So for this, I would have him have his shirt off, but for the sake of the fact that we're on camera, we're not going to be taking our shirt off today. I could drape a patient if needed, or they'd be wearing a gown, so it would be a little bit easier. But for the respiratory assessment, you do want to have their chest exposed. So the visual exam, I'm just looking as they're breathing. I'm assessing for any accessory muscle use while he's breathing. I'm looking laterally and anteriorly. I'm looking for any barrel chesting or anything like that. And I'm just going to listen and ask you to take a couple of breaths in and out for me, okay? Mm-hmm. Just skin to skin here. Take a breath in. Okay. Assessing laterally as well on the lowers. Good. And then I'm going to listen posteriorly. And I'm listening side to side in correlating positions. Good. And I'm not hearing any wheezing, any crackles, no bronchi, nothing like that. And then we're going to be doing a little bit of percussion, so if you could stand up or sit up straight for me. Sorry. I'm going to be percussing over your lung fields in the same places that I listened about. And I'm just listening for the tympani and listening for any abnormal dullness, which could indicate fluid or something like that, and everything seems fine with that. Next, we're going to move on to the cardiac assessment. So I'm going to be, again, it would be skin to skin, but we're not going to be taking our clothes off on camera for this. So I'll be inspecting his precordial area, looking for any like scars that could indicate previous cardiac surgery, any abnormal pulsations or heaves or anything like that. You just want to sit up straight for me. And also assessing his neck veins at this time, looking for any jugular vein distension, anything like that, which I don't see. So the first thing that we would do is we're going to auscultate as well. We're going to use the belt and the diaphragm for this. And we're going to be doing it in 3 different positions. So we're going to listen aortic, pulmonic, Erb's point, tricuspid, and then mitral. And then listening with the bell, aortic, pulmonic, Erb's point, tricuspid, and mitral. And then we're also going to ask him to then lay supine for us on that. Would you just lay on your back for me? Supine. And we can drape the patient as well to give them some privacy. We want to be just exposing the part that we are assessing. So we'll give them a lower drape. We're just going to be assessing your chest. And then in this position as well, we're going to listen to all of those points with the bell and the diaphragm. So again, it would be skin to skin, aortic, pulmonic, Erb's point, tricuspid, and mitral. And with the bell, aortic, pulmonic, Erb's point, tricuspid, and mitral. And then we're going to do a little bit of palpation of some of the cardiac areas here. So we're going to be palpating for the right ventricle, which will be, I'm just going to bring this down a little bit, the lower sternal border, the epigastric space, like feeling for any pulsation or heaves. Then we're going to be palpating for the base of the heart, the upper sternal border. No palpation, no pulsations or heaves. And then we're going to ask them if you can lay on your left side for me. From this position, we can palpate for the apex of the heart, the point of maximal impulse, which I can feel pulsating a little bit right there. And then you just stay there for a minute, and then we're going to listen to all the cardiac points from this position as well, with the bell and the diaphragm. Aortic, pulmonic, Erb's point, tricuspid, and mitral, and then with the bell, aortic, pulmonic, Erb's point, tricuspid, and mitral. And then you can just lay on your back again if you're comfortable. I didn't hear any abnormal heart sounds in any of those assessments. S1 and S2 were heard. There was no murmur, no friction reb, no extra heart sounds, and I didn't feel any abnormal pulsations or heaves or anything like that when I was palpating. So then we actually are going to stay in a supine position to assess your abdomen. And I can give him his drapes back. I'll give you an upper drape, okay? You can put your hands by your sides. And a lower drape for you. And again, he would not have a shirt on, so this would be why we'd be draping, just to kind of preserve privacy. And so we can expose just the area that we need to be assessing at this time. So the first thing that I would be doing is I would be assessing from the foot of the bed for any distension, any hernias, abnormal masses, or anything like that. Sorry. Which I do not see. And then I'm going to go right into auscultation for this as well. Do you have any tender areas in your abdomen that you know of?
No.
So I'm just going to start in the right lower quadrant. And it would be skin to skin, but I'm going to listen through the shirt for the video. You're listening 10 to 15 seconds in each quadrant for bowel sounds. Good. I hear normal active valve sounds, no tinkling. We're going to listen to the aorta, which is a little bit under the xiphoid process there. Then we'll listen to the renal arteries. And this is the iliac arteries by that. A little below the umbilicus, a little laterally. And the renal arteries are a little above the umbilicus laterally. Everything sounded good. I didn't hear any tinkling, any whooshing, anything like that. Next, we're going to move on to palpation. So we're going to start with light palpation. And again, he did not endorse any tenderness in any areas. So I'll just start in the right lower quadrant. And let me know if any of this feels tender or hurts, okay? And I'm palpating in each quadrant. And he does not endorse any tenderness. So we'll do some deep palpation. And this, I'm feeling for any abnormal masses. Which I do not feel either. Next will be percussing. So we're going to do the same thing. We'll start in the right lower quadrant. And we're listening for dullness versus tympany. Dullness indicates maybe over an organ, and tympany would be more of like an air-filled space for that. We are also going to percuss for the liver span, so I'm just going to move this drape up a little bit. Mid-clavicular line, starting about maybe like the third intercostal space. We start percussing until you hear that dullness right there come into play. And then you move, you know where that is, and you move into the right lower quadrant. And you do that up until you hear that dullness. And the liver span should be about 6 to 12 centimeters. Any larger than that may indicate liver disease. His seems to be perfectly within range. It's tucked under his ribs. Then we'll be palpating for the liver and the spleen. So for the liver, we'll stay a little bit below the costal margin. And I'm going to do some light palpation as you breathe in. And then when you breathe out, I'm going to press a little deeper. And I don't feel any liver there, which is a normal finding. The spleen is a similar thing over on the side. You can just breathe normally. And I'll palpate from the left lower quadrant up to the left upper quadrant to the costal margin. And you don't feel any enlarged spleen there. Nope, not able to palpate that at all, which is great. The next thing we're going to be moving on to are the extremities. So because he's kind of laying here, we can undrape his extremities. I'm just going to be taking a look at your arms first, okay? So I'm just going to like palpate and push down on his arms for 5 seconds and then let go and observe for any pitting edema, which I do not see. Then we'll be feeling for his brachial pulse, his radial pulses, and then doing capillary refill bilaterally, which should be less than 2 seconds. The pulses are +2. Do you have any numbness or tingling? I'm also noting color, any discoloration, the temperature of his skin, which is warm. Would you just close your eyes for me? I'm just going to lightly touch and let me know when you can feel it. So we're just assessing for his light sensation. Mm-hmm. Can you say it out loud?
Mm-hmm. Yep.
Okay.
Yep.
And then again?
Yep. Yep. Yep.
Okay, great. So his light touch is intact there, which is great. I'm going to just look at your lower extremities, okay? So I'm going to take the drape off. And I'm going to take your socks off. And again, we're doing the same thing, palpating for 5 seconds. There's no pitting edema. I'm feeling for his popliteal pulses. I'm also to take this moment to feel for any Baker's cysts or anything, but I don't feel anything like that. And then his dorsalis pedis pulses and his posterior tibial pulses. Taking a peek at his capillary refill. Temperature of his toes is warm. Do you have any numbness or tingling?
Nope.
Okay, great. And then I'm looking at his feet for any ulcers, any wounds. Everything looks good. And then I'm going to be assessing his light touch down here as well. Put socks back on.
Thanks.
Go. Let's make sure this is still going. Okay. Good. Would you close your eyes and let me know when you can feel me touching?
Yes. 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 Yes.
Great. So his light touch is intact there too. Put the drape back over him. So the next thing we're going to be doing is we're going to be testing some of your motor exams. So I'm actually just going to ask you to lay on your stomach for a moment if you don't mind. We're going to be testing his hip flexion or hip extension here. So, yep, good job. And then just don't let me push your leg down. Great. And then can you do the other one? Good. And then you can roll back over if you'd like. So his leg strength for his hip extension is intact. We're going to be now, you can just lay on your stomach. Can you raise your leg up in the air? Good. And then don't let me push it down. Great. And then again. Good. And then just push down on my hands like you're pushing on the gas pedal. Good. And pull your toes back up. Good. So hip flexion extension is intact. It's good against resistance. So is his dorsiflexion and plantar flexion as well. We're going to be testing his upper extremities. So you can actually move back into a sitting position if you'd like here. So for his upper extremities, we're going to be testing his shoulder abduction. So if you can just put your arms out like this. Good. And don't let me push them down. Good. And put them back down to the sides. Great. And then we're going to be testing elbow flexion and extension. That looks all good. And now I'm just going to do some resistance against that. Great. And now try to push my arms down. Good. And now for the wrist. Good. And then push them down. Good. So I'll give him 5 out of 5 strength all around. No problem. Next we're going to be doing some reflexes. So we are going to be doing the bicep reflex. So thumb. I'm going to take out my hammer, which is here. So yeah, just bend your arm up. Good, great. And now my thumb is on that tendon, his arm is relaxed, and then I'm just looking for that forearm flexion up as I'm hitting. Good. And I would do it the other side too, but for sake of time, it's the exact same on the other side, but we're not going to be doing that. I'll do the tricep reflex, so just relax your arm down. I'll hold it up for you. And then just looking for that, forearm extension. And then the brachioradialis. You just relax your arm kind of up like that, and then a couple centimeters up from the styloid process. Just looking for some hand, supination like that. Then we will be doing, if you want to come over and sit in the book, we can do your patellar reflexes here. His legs would be dangling nicely, just relaxed, and then just looking for that, and I would be doing it bilaterally again. And then we're looking at his Achilles, so just relax your foot down, and I'm looking for that, plantar flexion there. And then the last reflex we'll be testing is the Babinski reflex. I'm just going to stroke up, and get a little curl with down. And again, I'd be doing it bilaterally, but I'm running out of time a little bit for this video. So the next thing we're going to be doing, you can come back and sit on the thing here in a sitting position, is we're going to be moving on to the musculoskeletal assessment. So I'm going to be inspecting your knees, your shoulders, and your hips. So for the knees, I'm going to do this bilaterally. I'm assessing for color, muscle contour, shape, any bruising or swelling. I'm assessing, then I'm palpating the femoral shaft, and then the epicondyles, the MCL origin and insertion point, and asking for any tenderness. I don't feel any lumps or swelling. I'm just going to gently bend your knee in, the LCL origin and insertion point, and then again the other side, LCL origin and insertion point, the bilateral epicondyles, and then the tibial tuberosity and the tibial shaft, the patellar tendon, the patella itself, and then the popliteal fossa back here for any Baker's cysts. And there was no tenderness involved in that. Then we'll be doing a little bit of passive range of motion. So I'm just gonna ask you to relax your leg for me. So I'm gonna be flexing and extending passively his knee on both sides. And I don't feel any clicking, no tightness. It's equal bilaterally. And then I'm gonna be asking him to actively flex. Good? And then don't let me, I'm just gonna have some resistance as you kind of try to flex your knee again. Flex your knee down. Good strength. Good. And then down. Good strength. And was any of that hurt, tight?
Nope.
He's got good strength in his knees. Next, I'm going to ask him to stand up because we're going to be assessing his shoulder. Again, he would not have a shirt on for this, so I could really visualize everything. But I'm looking for symmetry. Sorry, so I'm going to be able to see. Symmetry, bilaterally, muscle contour, things like that. I'm going to be palpating, so we're going to start at the sternoclavicular joint on his clavicle here and palpate that, and let me know if any of this is tender, and we can go up the clavicle to the acromioclavicular joint there, and then we can feel the bicipital groove right there, and palpating that, and then the anterior glenohumeral joint line and the posterior glenohumeral joint line. Is any of that tender?
Nope.
Okay. We'll do the same thing on the other side. Start the other clavicle at the sternoclavicular joint, up the clavicle, and then the acromioclavicular joint there. And then we'll palpate the bicipital groove there. And then the anterior glenohumeral joint line and the posterior glenohumeral joint line. I don't feel any tenderness, or he isn't endorsing any tenderness. I don't feel any lumps or masses or swelling. Next, we'll do some passive range of motion. So I'm just going to move your arm through a couple things. Just keep it relaxed for me. So we're going to do some extension of the shoulder, flexion of the shoulder, and then we're going to do rotation of the shoulder as well. Good. Was any of that tight,
No.
hurt or anything? Okay, just relax your arm and let me move it for you, okay? So I'm just going to do some extension, flexion, and then rotation, external and internal as well. Did any of that tight or hurt or anything? Okay, great. Would you just go through those motions on your own for some active range of motion? Good, and then try to reach between your shoulder blades. Good, and for the other arm as well. And then reach up back between your shoulder blades. Great. Everything looks good with that. Next, we're going to be assessing his gait and his spine. So I'm just going to ask him to take a couple steps forward, a couple more steps so I can see you walk. Good, and then walk back to me. And his gait looks steady. It's even. There's no balance issues. Next, I'm going to be assessing some cerebellar function. So just turn around towards me, and then can you press or close your eyes and touch your nose, your finger to your nose. Good. And then you can open your eyes, and then just take your heel and put it on your chin. And do the other one. Good. So cerebellar function is intact. Next, I'll be assessing his hips. So if you turn around, everything looks good and even. He would have, again, like a no shirt on, probably some underwear. I'm looking for evenness, no contour irregularities or anything. And then I'm going to be assessing, I'm just going to be touching your hips a little bit. The anterior superior iliac spine up the iliac crest and down to the posterior superior iliac spine, the sacroiliac joint, and then the costovertebral angle there as well. Is that tender at all? Okay. And the greater trochanters. And just feeling for swelling, abnormalities, nothing there. Nothing was tender. So next we're going to do his spine. So I'm just going to have you bend forward a little bit. And again, he would have a shirt off so I could visualize if his spine was straight. And I'm going to palpate from the cervical all the way down to his sacral. Is that tender at all?
No.
And then his paraspinal muscles as well. I'd be palpating and asking if it's tender. I don't feel anything abnormal. I already did his costovertebral angle. And then we're just going to test some range of motion for the spine. So we already did some flexion. Can you stand up and flex back? Some extension. Great. And then we're going to do some lateral bending. Good. And everything looks good with that. So that completes our head to toe assessment.